What's up? My name is Ian Edwards.
Please welcome back to the show, the very funny Ian Edwards.
I came to truMD to see Dr. Setareh to get PRP for my knee. First of all, it's in Newport, so it's an ideal location. Newport is just a beautiful spot to come to. The offices are nice. Everybody was like hospitable and cordial when I came in. Dr. Setareh himself is a very cool dude who explained everything and made me feel completely comfortable.
Hey everyone, here with Ian Edwards here.
And Netflix is a joke, the festival. Now we gotta pay for this twice?
He's here today because of some knee issues on his right knee, right?
Yeah. I hurt my knee playing soccer, which I had no business playing. My knee was already swollen before I started playing, but I played anyway. I had a fun time, but I definitely paid for it afterwards. And I've kind of heard about PRP before. Like a friend of mine had neck issues and he had it done. And before, all he did was complain about his neck every conversation, and after he had it done, he was fine. So I was like, all right, this is a good opportunity to check this out for myself.
So we've already done an x-ray of your knees. I took a look at it already as well. You have some slight arthritis, nothing bad.
Okay.
Nothing bad, nothing that's really pointing where I can be like, aha, that's the cause. I do think that a PRP injection could definitely help you. So if you're okay with it, we'll get started by drawing your blood and spinning it in the centrifuge.
Mm-hmm. That sounds terrible, but...
And I know you're a little averse to pain, so, so we're gonna do it with lidocaine for you. In order to make sure he has the least possible amount of pain, right?
Yep.
The least possible amount of pain.
Big on no pain.
Big on no pain. We're big on no pain here too. I'm gonna use the cold spray first, and then a tiny needle, like a Botox-sized needle for some lidocaine, and then we'll do the PRP injection after that with the slightly bigger needle, slightly. So I'm just marking the area first. Little pinch here. Sometimes it burns a little bit as it goes in. How was that?
Nothing really.
Nothing really. You see?
I could feel like the fluid going in, like
Yeah.
filling up the back.
Yeah.
But yeah, I'm just looking forward to like just going back to the gym, continuing with my regular health schedule, and just being able to walk without hobbling is pretty sexy. So I'm looking forward to that. Going on hikes, just doing all the things that I used to do. Yeah, I'm looking forward to that.